Good afternoon, ladies and gentlemen of the community. My name is Carleton Overstreet, Jr. I am today's host and moderator. I'm also the chairman of the San Diego Hip Hop Health and Wellness 5K and Festival. As we welcome the public, we're going to have our experts from the health field joining us shortly. We're extremely excited to share some great information for you. Go ahead and grab a seat. Tom Brady and the San Diego Padres can wait until after this huddle. Teamwork makes the dream work. Stand by. We'll be beginning shortly. Good afternoon. My name is Carleton Overstreet. Thank you for joining us on today's webinar. We're going to begin here with our first slide. I just want to share with the public the mission of the San Diego Hip Hop Health and Wellness 5K and Festival. So if we can please pull up the slide here to give an update on what we've been doing as a team throughout San Diego County for those that are new to our platform. So let's go to that slide there. Our mission at the San Diego Hip Hop Health and Wellness 5K and Festival, we've been established since 2015 to unify community members from all 9 San Diego districts to celebrate wellness by providing healthy food options and an educational platform around music. We're also here to shift the cultural narrative of hip hop as a vehicle that brings health and total wellness to the forefront of investing in life. During the month of August and September, our team, who you can see, our team with the various locations below, distributed 44,280 free meals to the public. I want to say a huge thank you to all of the volunteers. We live by the motto that teamwork makes the dream work. And as you can see, we are doing the work collectively. Also here, I want to give a shout out to all of our extended family members, our community partners. Obviously, I do not have the time to go through every single organization here, but if you are a part of one of these many organizations, we thank you from the bottom of our hearts. There will be no possible way for us to reach the people that are in need with meals, education, service, and love without your participation. Many of the leaders are one phone call, text, or email away, and that is in the middle of the pandemic, and we do appreciate your sacrifice. Lastly here, before I introduce our panel, just similar to an airplane, similar to any vehicle, plane, train, or automobile, it takes gas to get from point A to point Z. For those that would like to contribute monetarily to contribute to our meal distributions throughout the community, the link is listed here below. And that's for www.friendsforfriendsfoundation.com/gallery will get you to the donation link. This enables to continue our service. Today's webinar discussion, which is centered around health is wealth, is dedicated to the memory of my aunt, Louise Overstreet, who lost her battle to COVID-19 at the age of 101. Without further ado, I'd like to introduce our panel. So I'd like to start with Dr. Wilma Wooten, who is our County Public Health Officer. We will circle back with the full credentials momentarily after our brief introduction of who's joining us. I'd also like to introduce and thank for joining us, Dr. Rodney Hood. We also have ICU nurse and artist extraordinaire, Miss Kaje Jones. From the City Council of the Mesa and the Weber Empire, Dr. Akilah Weber. Thank you for joining us. And speaking of planes, trains, and automobiles, I have Dr. Stephen Moyo joining us from satellite location from the, I believe that's an Amtrak train that he's on. And he's out in the field doing the work. I thank you all for joining us. So quick housekeeping, if you are not speaking, please mute your phone. We'll do the best that we can here to let anyone know that may start their dialogue, whether or not you remain on, you're still in the mute mode. But I want to start our presentation with Dr. Wilma Wooten, okay? I can't thank you enough. Our duty is to present roses to those that are on the front lines doing the work while they can smell it. And day in, day out, in the middle of Judge Judy, I'll get an interruption from any of the various news channels, and here comes an update from our county supervisors with the very astute and professional Dr. Wilma Wooten. Some of our students, some of our hardworking parents are out at work and in school classrooms, so it was very important for us to invite Dr. Wooten to this 4 o'clock hour to give us the statistics and the just plain Jane facts on what we need to know as a community, primarily a community of color, primarily millennials, Generation Zers, and everybody in between and beyond, of what we need to be doing to practice safety precautions to maintain our health. As the San Diego Hip Hop Health and Wellness 5K and Festival, it behooves us to have the industry best. So thank you for joining us, Dr. Wooten. If you can, please give us an update on what we need to know from your end as it relates to the county updates. And shout out to the Multicultural Health Foundation, Regina Evans, Dr. Flalo, Dr. Hood, and your staff, Nora, and everyone working behind the scenes. We're going to fix the quick screen share. Nora needs to be able, she can't share the screen. And then just give us just a few seconds here, and we'll hear from Dr. Wilma Wooten. Nora, you should be able to share your screen now. And Dr. Wooten, the floor is yours. Thank you for joining us. And Dr. Wooten, you can go ahead and unmute your phone and begin your presentation. Thank you. Yes, you're unmuted. Go ahead, Dr. Wooten. We will return shortly back to Dr. Wooten as we fix the bug here. Dr. Hood, if you can please give us a state of the union as it relates to the Multicultural Health Foundation and the progress report on your end. Dr. Wooten, we will be back to you shortly.
Okay, hello everybody, can you hear me?
Yes,
you can. Okay, thank you. So thank you very much for inviting me. For those of you who don't know, I'm Dr. Rodney Hood. I'm president of the Multicultural Health Foundation. I am happy to say that as a co-founder of the COVID Equity Task Force that was formed 4 or 5 months ago, we have been very active advocating for our community, Southeast San Diego, and was successful in establishing 2 test sites here in Southeast San Diego. One is at the Euclid Medical Center, right up from the Jacobs Center. It's a drive-through test site that is open every Saturday. You need an appointment in order to get tested there. There's a second site at the Tubman Chavez site, open every day. I think it's from 8 to 5, no appointment needed, and it's a walk-in site. It at one time was the busiest test site in the county. They were doing over 500-600 patients per day. But since then, the county has opened up multiple other sites, taking the pressure off of that site, and is still quite busy, testing about 200 to 300 patients a day. So before we began, we saw test sites open other places in the county, but the data suggested the highest impact zip codes were in Southeast San Diego in Chula Vista. I'm happy to say that since we opened up the sites, we've seen the testing drastically improve in Southeast San Diego. I want to congratulate the County of San Diego, Department of Health and Human Services, especially Dr. Wilma Wooten, for all her support in helping us to achieve those goals. I also want to announce that our county, Department of Health and Human Services, as opposed to a lot of other county, really understands the concept of equity, meaning COVID hits, it affects certain communities at a greater rate than other communities, and therefore more resources should be focused on those communities that are hardest hit. That does not always take place in many counties, but with the leadership of Dr. Wooten and Nick Machione, it is happening in San Diego. The Multicultural Health Foundation received a grant from the county to focus on African Americans, outreach, education on COVID-19. We just received the grant about 2 weeks ago. We are bringing on some dynamic staff, community health workers that will start doing some countywide media outreach to the whole 185,000 African Americans in the county of San Diego. You should be seeing billboards, media, print, aimed at how getting the message out to protect ourselves against COVID-19. So hopefully in the next few weeks or so, you'll be seeing more and more about how our community can stay safe during this pandemic. There's a executive team that I chair that includes Dr. Susanna Fallo, Regina Evans, Reese Jarrett, Minister Muhammad. We have Dr. Bob Gillespie and myself. We meet every week formulating a strategy to help us with the grant. We just brought on another dynamic individual. Her name is Cynthia James Price, who is helping us implement the grant. So I think we've been quite successful advocating for the community. I think the statistics that you see on the county suggest that although we're highly impacted, the resources that we need to kind of do testing and hopefully treating has been allocated to a fair degree in moving forward. I hope it continues. So let me just stop there. And if there are any questions, I'll be happy to answer.
Well, we're going to get to the questions shortly. Can everybody hear me okay? Go ahead and mute your phone, please, Dr. Hood. And next, I would like to introduce Miss Kaje, who is a recording artist and also a COVID-19 survivor, a family friend. And I'd like for her to share just, you know, don't hold your tongue, don't bite your tongue. I want you to just give us a real life journey on what you experienced with your situation working in a hospital and testing COVID-19 positive. So go ahead and unmute your phone. Without further ado, I'd like to introduce Kaje.
Thank you for the introduction, Carleton. Well, as he said, not to hold my tongue, I tested negative for COVID-19 in July, and my boyfriend, who I live with, he tested positive. We both had the same symptoms, and it was a very, very heavy illness. It's definitely the sickest I've been in the last 2 to 3 years. I really don't get sick very often. I do work in a pulmonary surgical ICU where we care for COVID patients. And believe it or not, I actually didn't get it from work. I got it in the community, taking the kids out. They were socializing with other kids in an area that was supposed to be, separated. But we were sick for 3 weeks. I'm 26 years old. He's only 32. And for it to have impacted our lives the way it did, and the fact that I get to see how it impacts, a variety of people on different age ranges, it's a really heavy illness. Like, it definitely is taking a lot of people out very quickly. It spreads so easily. I wouldn't have thought that, we would have gotten it the way we did, as quickly as we did. It was a really difficult time because you're quarantined for not only the 14 days that they say, but also until you're symptom free. So we weren't symptom free until about 19 days in. So it was heavy. Thank the Lord that we survived and we were able to make it through, but I have seen it impact others in a much more dire way.
One of the questions here in the chat was, how did you know where you contracted COVID-19?
I don't, know, but I can assume where I got it from because of when my symptoms showed up. And we were wearing masks everywhere that we went, except for when we took the kids to an outing, where they were outside playing. It was actually at the pool, so you don't wear masks in the pool, obviously, and they were commingling with a few other kids. So, and within 48 hours of that situation, we all had symptoms. The kids first, the kids actually their only symptoms were fevers. And then we had all the symptoms, in which we both went and got tested.
And Kaje, if you didn't let the public know, how old are you?
26.
26, got you. So have you been advocating to the rest of the public? Have you, besides this formal Zoom panel discussion, do your friends and family members know, and your coworkers know, hey, I tested COVID-19, but you've since tested again and your results were negative. Have you been outward in sharing that information?
Yes, definitely. As soon as I found out that that's what we had, I told everyone that we had been, in contact with within the last 2 weeks. And yes, I have tested negative since that time.
Beautiful. We're going to come back with some more questions for you, Kaje. I'd like to also bring to the forefront Dr. Stephen Moyo with Wealthy. He's the founder of Wealthy. If you can go ahead and come to the screen here, Dr. Moyo. I know that you're traveling, and we appreciate your time. And if you could just let us know, let the public know what your background is here in the health field, and how you've gotten connected with the Hip Hop Health and Wellness 5K Festival. And like I'm telling everybody, don't hold your tongue. Let us know what you're in the life of a doctor on the move.
So I'm going to actually pass it to someone else for now, just because I'm just getting off the train and I don't want to not give you my full attention. So I should be static soon, and I'll be able to not hold the tongue and let you know what's been going on in my life.
Fantastic. Listen, we appreciate your time. We'll be introducing Dr. Akilah Weber from the City Council of La Mesa. She is a mother, a big sister to me, a doctor, and Dr. Weber. A lot of people have seen you on the front lines with the City Council of La Mesa. You are part of a very successful sneaker drive with the youth in the city of La Mesa this summer. We appreciate your involvement there and bringing your constituents from the La Mesa Police Department and just your leadership and your prowess, your tenacity to get the truth out and to stick with the solutions is something that we applaud you for. And thank you for joining us today. If you can, introduce us to the doctor of the Weber empire and let us know what a day in the life of Dr. Weber is like, outside of being a mother on top of that and a big sister to us. Thank you for joining us. Let us know a little bit about what you do on the health side.
Well, thank you very much, Carleton, for inviting me this evening. Thank you to San Diego Hip Hop 5K Wellness for all that you're doing in the community, along with the Multicultural Health Foundation. I feel very honored to be on this call. We truly, truly, truly have some giants in our community. I've known Dr. Hood for a long time. I respect him and his family immensely. He has been in the community, fighting for the community, advocating for the community for years. And when COVID, hit us, he was right there in the forefront, ready to continue that battle. And so, even though I live in La Mesa, I represent La Mesa, I am born and raised in Southeast San Diego. And so Southeast San Diego is always in my heart. And it just warms me immensely to know that there is someone who's advocating for the residents of Southeast San Diego to make sure that, we are not left behind there, that we have the testing, that we have the resources, that we have the knowledge, and that we will be taken care of in that community, just like every other community is taken care of. So I want to definitely give my highest gratitude and honor to Dr. Hood for all that he has done. Want to definitely thank Dr. Wilma Wooten. We have a jewel in her in our community. She is definitely fighting for all members of San Diego community, making sure that we are maintaining our safety, maintaining the fact that we are well informed. I don't know if anyone watches her presentations, but sometimes there have been people in other areas in Northern County that have tried to attack her. And it is very important that we have someone here who is willing to stand up and be truthful and honest about COVID, about the numbers, and about what we need to do to keep ourselves and our families safe. So I definitely am honored to be on this panel with her, and I really want to thank her for all that she's done and just really encourage her to continue to do the amazing work that she's done. As Carleton said, I wear many hats. You know, my first hat is a physician. I am an OBGYN. I also specialize in a very unique area. So I work at Rady Children's as well. And, you know, there's been a lot of changes in how we practice medicine. We switched over to telemedicine, which I think has been very beneficial for a lot of people, especially for people who are not able to come to their doctors for whatever reason. And it also decreases your chances of being exposed to COVID if you're able to see your doctor from home or from work and not actually having to come into the clinic or into the hospital setting. And, you know, I'm also a mother, so my kids are home. And I'm juggling that as well, the distance learning,
not an hour and a half,
and teaching them. And so, you know, I feel all of the other parents who are struggling, working and teaching, and my heart definitely goes out to you. And I just want everyone to know that we will get through this together. But the important thing is that we continue to think of we and not me, especially for our millennials and our members in Generation Z. You know, and as a society, we have to take our responsibility for the fact that we often applaud individuality, thinking as an individual rather than thinking of as a community. However, we cannot get through this unless we all think that we have to work together. So you may not like to wear a mask, or you may think that because you're 26, you'll get a mild cold, but not realizing that you may pass it on to your mother, your grandmother, your children who may pass it on to other people. And so thinking of a collective we, that's how we as a people have been able to overcome so much, and how we have been able to survive so much, is to think as a collective unit and not as an individual unit. And so that is my plea for our millennials and our Generation Z, that, you know, kind of put the stuff that we've been telling you that you need to think about. And how do you feel? What do you want? How do you like this? And really sit back and think about the community as a whole. And that's how, you know, we as a people will be able to overcome this as well. So I'm going to stop talking and I'm going to throw it back over to Carleton and just thank you so much for having me.
Thank you, Dr. Weber. I have to make sure that I call you doctor and not sister, big sis. Okay. It would be remiss if we did not give yes on Prop 16 a few minutes here in this dialogue, because bottom line is we want to level the playing field. We want to bring back affirmative action. So we need more Black doctors. Okay. Without further ado, I want to see if we're getting everything set up on Dr. Wooten's side. We should be good to go. And thank you to the public for bearing with us. Dr. Wooten is here to educate us all on the do's and the don'ts of navigating COVID-19. So Dr. Wooten, Nora, go ahead, you have the floor. If for any reason we're still faced with technical difficulties, we'll bounce over to Mr. Moyo. So go ahead and unmute your phone. We have the slides up. Okay, Mr. Moyo, it looks like you've gotten off of your train. We're still navigating a few technical issues on Dr. Wooten's end. Please introduce us to Wealthy, sir, and how you got connected with the San Diego Hip Hop Health and Wellness 5K Festival. We applaud you for showing up today. You could have canceled on us, you had to deal with an emergency, but you've shown up for the community. Just give us your background on with Wealthy and let us know what you have to provide for our community. Thank you for joining.
Absolutely, and thank you so much for having me. I'm going to assume you guys can hear me. I think I'm off mute here. Apologies for being in transit. It just so happened that life did what it does sometimes and rearranged the schedule today, so here we are. My name is Dr. Stephen Moyo. I'm a physician in San Diego. I am a CEO and founder of a company called Wealthy. That's Selfie with a W. Wealthy is building a digital health platform that focuses on community. Our goal is to empower community leaders, physicians like myself, fitness coaches, even school administrators to better take care of their communities. We entered 2020 really with a focus on heart health. That's a personal area of interest and professional area of interest for myself. But as 2020 started and as COVID-19 frankly took grip of the world, it was just so important that we did something for helping communities deal with COVID-19. The community that we decided to focus on is K-12 schools. And as a physician, I actually did my medical school at Michigan State University. While I was there, I was part of a program called Leadership in Medicine for the Underserved. That really instilled in me just the importance of physicians and leaders in the community focusing on underserved populations. Dr. Hood earlier mentioned health equity, and that's exactly what Wealthy is all about. And as we focus on K-12 schools, our focus is on health equity. It's how do we help the schools and districts that are underserved? How do we help their students and their teachers not only tackle COVID-19, but the list of epidemics that are happening within schools, whether that's childhood obesity, asthma, mood and behavioral issues. So Wealthy right now focused on COVID-19, but it's a larger school health platform that we're building. My connection with SDHH5k, really, it's an interesting story, which I won't get too far into it, but I had the privilege, along with Wealthy, to help sponsor the run last year. Got connected with Carleton, got connected with Dawood, and it's really just been one of these relationships where I feel like I can't give enough because I get so much from it. So thank you for what you guys are doing in the community. Thank you for inviting me on this platform here today, to echo what Dr. Weber said, to be on a call with the likes of Dr. Wooten, Dr. Hood, who are definitely role models in the community that I've been hearing about and can't wait to meet in person one day, hopefully with the mask off. It's a true honor. So thank you.
I want to start with you, Dr. Moyo, especially navigating through COVID-19 as a young Black doctor, in the midst of the other pandemic, of just being a Black man. How do you maintain your healthy mental health on an ongoing basis? Give me some things that you do, that you practice to maintain a positive attitude to get through the day. It's very important.
Yeah, no, I think that's it's tough. It's tough right now, to be honest with you. I think as I'm thinking through the list, for me, it's faith, it's family and friends, and then a very real part of it is coping skills. As a physician, I work in the hospital. I work as a hospitalist. So I was talking before we went live. Kaje and I both work at the same hospital, and if you are a patient coming in with COVID-19, you're likely to see myself and my colleagues first, and hopefully you stay healthy and you head home soon after that. But if you don't, you might end up in the ICU with Kaje. For me, as a physician with a young family, my wife was pregnant during COVID, and we just had our firstborn son this past July. So we were navigating that really from two angles, which was how do we keep our little growing family unit safe? And then how do I, as a physician, keep my wife safe and keep my family and friends safe as well, because I am on the front lines. And the mental health and strain of that definitely did weigh on me. It brought a lot of anxiety that I usually don't feel. I think the toughest thing when it comes to dealing with the situation that we're in right now is all about knowledge and facts. For me, anxiety goes away with the more that I know about it, and trust and confidence in our leaders. So I think the work that Dr. Wooten is doing, for example, communicating these facts to the community is so important to help alleviate that anxiety. And then for, a day-to-day sort of very real way that I help de-stress, music actually is a big part of my life. So just actually turning off the TV, turning off the news, turning off, the radio, and not hearing about the stressors, and just zoning out, frankly, with your favorite album is just kind of a way that I help alleviate all of that.
And what'd you listen to today?
Oh, today, what have I been listening to? Today's just been a mix. There's a little D'Angelo in there today. I went back to the Brown Sugar album.
My God. Okay, we're going to see if we could get Dr. Wooten. Thank you for bearing with us here. We've had some technical challenges on the audio end. So if we can, Nora, let's go ahead and see if Dr. Wooten's audio issues have been addressed. Hey, Akilah, Dr. Weber, excuse me. Speaking of mental health, when going through a crisis, a tough day, a city council, the Mesa, having to be a super mom, having to navigate with COVID-19 and tough parenting, parents that come into your doctor's office. Give us just a quick clue into how you maintain your mental health, positive mental health.
My positive mental health. Well, first, since you opened the door, I do want to remind everyone to vote yes on Prop 16, as Carleton alluded to. That does repeal Prop 209, which took away affirmative action here in California and has had a devastating impact for all minorities, including women as well. So, everyone make sure you're voting and voting, yes on Prop 16. These last few months of this year have been really, really challenging for all African Americans, because not only are we dealing with COVID, this pandemic, but there have been a lot of issues racially, locally, and nationally. And then, for those of us who are parents, it's been challenging now holding the hat on as a teacher. So Carleton, actually what I've started doing is a couple things. I wake up very early in the morning so that I can have my me time. And I do at least 10 minutes of meditation. There's an app that I use. And then after I've done that, I do a yoga routine, and then I go and walk. And that really helps me clear my mind, stay focused, and prepare for all that life is going to throw at me for the day. And for a while, I was even including my two boys, who are now 7 and almost 9, on the walk. Because I'd wake them up and I'd say, okay, we're going to go on a walk of gratitude, and just observe and breathe in the air, and be very grateful for waking up and for all that you can see in your surroundings, the flowers, the plants, the bugs, or whatever. But I do that every morning. Because it is a lot. And if you don't have your you time and your way to de-stress, you will go crazy with everything that not only us physicians, but just anyone who's living in this time, especially if you happen to be a Black American. We're getting hit on so many different angles right now. So that's what I do to maintain my mental fitness. And I'm very happy that I have instituted those things, because I definitely need them every single day.
Amen to that. Dr. Hood, please give us some insight on what you do. I mean, thank you again for everybody for joining us here. Dr. Hood, you are a legend in this health field, and we know the things that you're dealing with on a day-to-day basis from a political and a health standpoint. require a lot of focus and focus and some more focus. How do you maintain your positive mindset, and what do you do on a day-to-day basis to maintain a positive mental outlook?
Carlton, thank you for that question. And I must say it is much more difficult during this time because you're so restricted in kind of what you kind of like to do. But I think especially for African Americans, I think I heard Dr. Weber talk about meditation. I think that's critical. I talk a lot of what I call PTSD, post-traumatic slavery disorder. What I mean by that is there's some specific stresses that are unique to African Americans that affect us. All of these crazy things we're seeing.
Oh, Jesus.
All these crazy things we're seeing on TV cause us even more stress than other populations. So I think of finding time to yourself, whether that's meditation, yoga, whatever it is. I try to do that. I'm not going to say I do it every day, but I do it most days. I work out 2-3 times a week. As you get older, like I do, the running and jumping and jogging isn't really good for the joints. So I'm fortunate enough to have a pool. So I do a lot of workout in the pool that kind of takes the stress off of my joints. And I'm still old school. I like to read. Reading is very therapeutic for me. I love history and biography. I'm an early riser, so most of my meditation and calming down is usually done in the morning. So meditation, stretching exercises, and working out on a regular basis. And this may sound strange. I do a lot of talking about the history of race. To be honest, that's that's one of my stress releases. I tell my wife all the time, she says, you're always talking about race, but I said, most of us don't. As African Americans, we tend to have two personalities. We kind of talk one way when we're in company of people that look like us, and then we're in company of people that don't look like us. Sometimes we have another conversation, and we're very good at it because that's what we learned to do to survive. But I also think it's very stressful. And so what you'll find out about me is I try to focus on having one conversation. So sometimes people are very uncomfortable when I have conversations about race and the audience is mixed. But I think if we learn to have one conversation about the issues that we're going through, I think that's very therapeutic.
Dr. Hood, we couldn't thank you enough. And as a trusted community resource and liaison for the millennials and Generation Xers and Generation Zers, we stand here on the front lines to help out the Multicultural Health Foundation and getting the word out on the importance of practicing, everything under the umbrella of safety. So utilize us as a resource. Again, I want to thank Dr. Aflalo. I also want to thank Regina Evans. I want to thank your staff, everybody that has been helping on the administration side, because the hardest part is just bringing the people together that are out in the front lines, spread thin throughout the community. But at the end of the day, what we have to do is, schedule time, block out time, meet, share resources, and continue progressing together through this pandemic, epidemic, whatever you want to call it. I'm going to circle back, and I want to thank everyone that's been helping us over at Dr. Wooten's office. We've had a technical glitch, but as we understand with COVID-19, the devil is a lie. We are going to fight through this to get the information to the people. I'm going to greenlight her team, Nora and anyone else on the staff. It looks like you guys have maybe fixed the audio issue. If so, just go ahead and unmute yourself and start talking. Dr. Wooten, are you there?
Yes, I am. Can you hear me?
Yeah, we got you. We got you. That was a lie. Okay, thank you. Welcome. Welcome to our educational panel on health. And we want to give you roses and more roses and more roses and more roses for all of the work that you've been doing to keep us healthy. Go ahead and take over. The floor is yours. You can take it however long you want. Go ahead. Thank you.
Well, I will be brief, but I just wanted to share information with you and thank you for the opportunity to talk about our local data and what it's telling us and how it has impacted the millennial and Generation Z groups. So to date, we have almost 50,000 cases of COVID-19 in San Diego. The slides are moving a little fast. You can just go back to the graphics, the pie graphics for general population. So we've had almost 50,000 cases of COVID-19 in San Diego. This graphic is basically just showing the general population for whites make up 45%, Latinos almost 33%, then Asian Americans just over 12%, and African Americans just over 5%. So what I'm hoping to share with you is some information specific to the millennial and Generation Z groups in terms of how they have been impacted and compare that to the general population. Now in the next slide, this is what we call an epi curve, which basically is the illness, onset of illness, the day that individual's illness is reported to the county. And so you'll see here that in the middle of June, we started to see our cases go up as the state opened up a lot of various businesses. And then things were getting out of control with the cases. So in mid-July, the state issued health officer's order to restrict opening of various sectors and businesses. And we saw, with adhering to those non-pharmaceutical interventions that I'll talk about at the end of this presentation, is that we saw cases go down. So this is evidence that if we do the right things, we will see the right results. And so as businesses were closed, then the state actually developed a new state monitoring system and metrics that could be utilized across the state, and it basically placed counties in one of 4 categories: purple, which is the most restrictive; red, which is what San Diego is in, which is the and that's tier 2. Purple is tier 1. Even though it's a low tier number, it has the highest restrictions. And then it goes all the way down from red to orange. And red actually represents substantial spread of COVID-19. Purple is widespread spread, or widespread transmission, rather. Orange is moderate transmission, and yellow is minimal transmission. And there's a lot of questions as to why don't we have a green tier. And that's because green would mean that everything was back to normal. There's no transmission. So that's why the colors do not include green. So that was August 31st. And as you can see with the daily reports of cases, we have managed to stay in the red. It has been challenging, but we are in the red. And then last week, the state rolled out a third metric. The first 2 metrics are related to case rates and testing positivity. And now the third metric is related to a health equity metric. Dr. Hood talked a lot about health equity, and someone has changed the, we don't have access to the slides. But in any regard, we are managing to keep right there, to keep our cases below. We want to keep them below. We actually want to keep them below 200, but we've been between 200 and 300, definitely below 400. To stay in red, we need to have cases, daily cases, on average of about 236. And if we want to move to orange, we have to have 133 or less daily cases. So I don't see the 133 happening anytime soon, because we know that this virus is in our community. So we remain in the substantial transmission or spread of the virus. Moving on to the next slide. Next slide. And I apologize for the challenges that we're having. Usually we are in slide mode, but anyway, what we are trying to identify or characterize here is that from 0 to 39 years of age, that group makes up 57% of the cases, of all of the cases that we are reporting in San Diego. Millennials are born from 1981 to 1996 and represents the 24 to 39 year of age group. Generation Z, born after 1996, and that's the 23 year of age and younger. So that's why we blocked out the decade groups 0 to 9, 10 to 19, 20 to 29, and 30 to 39. Again, those populations, those age groups make up 57%, which is the majority of all of the COVID-19 cases in San Diego. Now, females make up 51% of the total cases, males 40, almost 49%. And about 7.4% of individuals that get COVID are hospitalized. And again, 1.7% or 819 unfortunately succumb to this disease and unfortunately dies. If we look at the race and ethnicity by cases, this shows that Hispanics or Latinx makes up the majority of all cases, 62%. And whites, 25%, followed by 5.7% Asian, and then African Americans, 4.4%. Going to the next slide, if we look at hospitalization, so compare the fact that 57% of individuals are in the 0 to 39 age group. Only 17% of that same age group is hospitalized. So the individuals that are hospitalized, 71% are 50 years of age or older. So while these two groups, millennials and Generation Z, are infected more than other age groups, they are not hospitalized to the point that their older counterparts are hospitalized. If we go to the next slide, and I just want to remind you that all of these stats can be found on the county's website, coronavirus-sd.com, and we have race and ethnicity data for our cases, for hospitalizations, and for deaths, as well as for our contact tracing results, again by race and ethnicity, and for our staffing. And we have a specific data by race and ethnicity on our county web section. Now, moving on to I think I've said this already, but basically about 1% of the deaths are between the ages of 0 and 39 years of age. So while your millennials and Generation Z might be infected more, they are not hospitalized, and there are rare deaths in this population. If we move to the next slide, I just want to talk a bit about health equity. And health equity has been a priority for the county since 2008, particularly for Health and Human Services Agency since 2008. And it is the foundation of our Live Well San Diego principle, which includes these three components of building better health, living safely, and thriving. And the health equity metric, I talked a bit about that. That primary focus is looking at, it's utilizing the Healthy Places Index, California Healthy Places Index, and it stratifies all of the communities by census tracts in San Diego from the highest quartile to the lowest quartile. The highest quartile obviously are healthier communities. The lowest quartile are those communities where individuals need more resources. So, and it follows the population distribution in San Diego as well. So in South Bay and actually in some parts of the northern part of the county, we have those census tracts that need more resources. And our metric for that has been assigned to us by the state based on where we are based on that Healthy Places Index is 6.2% testing positivity in those areas. Keep in mind our testing positivity for the entire county is 3.8%. So our mission going forward, and we have to submit a plan to the state next week, is to identify, I always like to start what are we currently doing? So we look at the as is, and then we document what can we do more. And we will be working with our community partners to help us, number one, educate and provide education and outreach, but also to additionally implement some of the strategies that we come up with. And the most immediate strategies would include, aside from education and outreach, is testing. And from the very beginning, as Dr. Hood stated, we've been intentional in ensuring that we have testing sites that are in those areas of the county where we know are the lowest incomes and are represented by those individuals that need services. The HPI, or Healthy Places Index, is focused or based on health disparities areas, and there are 6 areas, including education, environment, social issues, transportation, and housing. So that's how these census tracts are identified for the lowest quartiles, but the issues and strategies that we implement are related to testing, contact tracing, making sure that people have a safe place to be housed if they do develop COVID-19, and also making sure that we are addressing some other financial issues like daycare or income. And we have been doing that thanks to the CARE Act funding. We've been doing that since this pandemic has been in effect. So those are just some of the things that we are doing with that health equity focus. If you go to the next slide, I just want to end with what can you do? Millennials and Generation Z groups can do the same things that we ask every other resident in San Diego to do. It's to follow these prevention strategies: washing your hands, keeping 6 feet apart from others, at least 6 feet apart, wearing a facial covering, avoiding crowds, particularly parties. Our younger population thinks that they are invisible, or rather that they are that this won't affect them. So we want them, and as you've heard from the individual that was infected, this is a serious and real and disease, and it affects all ages. It has no discernment for whether you are a 3-month-old or 102 years of age. So avoiding crowds, staying home if you're sick, and these factors, go to the next slide, These prevention strategies help to drive the testing positivity rate down and the case rate down. And in the next and last slide, if the testing positivity rates and the case rate goes down, then this means that we can transition to a lower or less restrictive tier on the state's framework so that more businesses can open up. So that's the so what and why it's important to everyone, from individuals to businesses, to adhere to those prevention strategies. And I will end there. Thank you.
Dr. Wooten, thank you so much, not only for your time, but your professionalism, not only for your professionalism, but for your relentless facts. We know to your left you have Mr. Greg Cox. To your right, you have Nathan Fletcher. And in front of you, you have the entire world asking to get back to normal, you know, without recognizing that you are just a professional doing the best you can with what you have and what you don't have. And your statistics, your team, and all of those that have been, you know, striving for greatness together is what is helping our community as a whole thrive through COVID-19. Anyone that knows me knows that I am strictly about the solutions. You can bring me problems all day long, but how do we get to the solution? And with our team and our efforts out on the front lines, as I mentioned, in August and September, distributing 44,280 free meals to the community, to the county. It takes a team. It takes a village, and it takes wisdom to not be out there putting yourself and others at risk by doing everything that you and your team is telling us not to do. So what I did here, and for the sake of time, we are going to be wrapping up here, and I'll get back to our other panelists. But I actually have a 14-year-old that I want to introduce to you, Dr. Wooten. And she's going to introduce herself. She has a question for you. And without further ado, here we go. Yeah, that's Dr. Wooten.
Dr. Wooten, if I have a face shield, can I wear it instead of a mask? And I'm 14. My name is Zola, and I go to Grand Hills High School.
What just happened at Grand Hills?
One of my friends got COVID from my school.
I'm sorry, is the question that should children wear facial coverings?
Face shields.
Face shields.
Yes, face shields. So we reserve the recommendation of face shields for instructors that are working with young children that need to look at the teacher's mouth so that they understand what they're saying. Or if children have learning disabilities, we would recommend face shields for the instructors. Now you see, actually there are actual advertisements on television. There's a local company that makes face shields, and they're recommending them in the place of facial coverings. Face shields do not replace masks or facial coverings. And actually in the hospitals, the face shields are used with goggles and facial coverings along with gowns and gloves.
Thank you so much. I have another question from Dr. Jerome Robinson, who says hello, along with plenty of others that we are your fans here. Dr. Shane, or Reverend Shane Harris, and plenty of others send their regards, and as well as Dr. Fred Johnson. Dr. Jerome Robinson's question was specific to African Americans, and you gave a percentage, but we want to know, just as far as San Diego County is concerned, if you have that ready to provide, how many African Americans have passed away due to COVID-19?
Well, in Dr. Robinson's question, he asked, "Can we believe there have only been 34 African Americans who have died?" And that's what the data shows. We report individuals' cases. Cases overall are cases that are confirmed. So we have a confirmed PCR test. We do not report antigen tests in the PCR test. Antigen tests are probable. PCR tests are confirmed, and that's what we report. Now, certainly someone could have contracted COVID-19 and died and was not tested, but for those individuals that are those positive tests that are reported to the county, and that includes individuals that have died, we have only identified 34 African Americans who have died during this pandemic due to COVID-19. Those are the data
Thank you.
that we have. Mhm.
Thank you. And then last question here, and before we wrap up, as a event coordinator of the only 5K in Southeast San Diego that shuts down Imperial Avenue, 47th Street, and Ocean View, as a concert promoter and as a drummer, a musician, my entire business has been shut down. So when we talk to others that are in my field, can you please explain to us the nature of community outbreaks, clustering events, and why these large gatherings are going to be put on hold indefinitely, if it's left up to our experts?
Well, I can tell you that if we were in the yellow, community events that such as you have described might be possible, but we are still in substantial spread. So the various businesses that are recommended to be open are on our website, and we don't want to get beyond that because we're trying to drive the case rates, the testing positivity, how many people in the community test positive, and then how many, once they test positive, how many become actual cases. We're trying to drive those metrics down, and that's very important to decreasing the spread. If we have festivals, street events, and there is some allowances for certain things, like there are swap meets that are open, but they're outside. Drive-in concerts. But we know that people will be people, and even with those restrictions, people still get out of their cars and they dance. When people are singing or when people are talking loudly, they are dispersing droplets, viral droplets. So that's why those activities are not allowed. So, and we recognize that this is very hard for the various businesses and entertainers, wedding event planners, all of those individuals that are in those groups. But to not allow those activities to occur is to help decrease the spread of the virus, and it is to help make sure that our community continues to be healthy. Thank you.
Dr. Wooten, thank you so much. What I'm going to do here is wrap up our webinar. I want everyone, we're going to go around, starting with Dr. Wooten. I think that I know what your answer is going to be, but please leave one resource for our community to continue to follow on the right path of staying healthy. And after Dr. Wooten, we're going to go to Dr. Hood. After Dr. Hood, Dr. Weber. After Dr. Weber, we're going to go to Dr. Moyo, and we'll end with you, Kaje. So please share with the public just one resource on where to follow, the right things to do, navigating through the rest of this pandemic. And then we'll end on that note. God bless you. Thank you.
Well, if I had to pick one thing, I would encourage everyone to follow the recommendations that were included in the last 3 slides and go to our county's website, coronavirus-sd.com, for information about what's going on locally in terms of our data and other resources to the various sectors throughout the county. Thank you.
Yeah. My advice is remember that our number one asset is our health. And we talk about Black Lives Matter. And I think that ties right into, it's very, since this is hitting Black communities heavier than other communities, I think we should extend that Black Lives Matter to make sure that we do all the things that you heard Dr. Wooten talk about. Please wear a mask. It's after we go about 6 months, people get tired, lackadaisical, you didn't get it. And I'm really talking to the youngsters out there. It's critical that you wear a mask. If you feel you're exposed, there are plenty of test sites out there to get tested to kind of find out. Remember, even if your test comes back negative, that does not mean that you can't spread it.
Thank you, Dr. Hood. Thank you so much. We needed to hear that. Let's go ahead to Dr. Weber, and we have 2 more.
All right, I will be very quick. The only thing that I want to say before we get off is to just remind people that one of the scariest things about COVID is that it is absolutely new, and we don't really know that much about it. And therefore, if you got it and you say, oh, it's just a little cold, it's just a little cold, you don't know what long-lasting effects it's going to have on your lungs, on your heart, on your body. And so we're now talking about the long haul syndrome. So you may be 26 and had a little cold, but you don't know in 5, 10, 15 years, this may play a significant impact on your health as well. So, definitely follow the recommendations so we can all get through this. And so you don't end up dealing with this condition, which will now be considered a pre-existing condition for insurances for a very long time. So thank you for having this, and thank you for having me.
Dr. Moyo.
Sorry about that. Yeah, I think this is a really interesting time where everybody needs to take a moment and really sort of reset and focus on their health and getting good understanding of their baseline. Everything from your blood pressure to your blood sugar to how you feel when you wake up every morning. I think, as has been underlined, COVID-19 can often be asymptomatic, so without any symptoms, or can present with really subtle symptoms. So knowing what's different from the day to day for you can really help protect yourself, your family, and your community.
Thank you for that. And Queen Kaje.
Thank you guys for having me, and also thank you for all of the valuable information that you all touched on. It's also important, like Dr. Weber touched on, it's about being courteous and thoughtful for other people and being aware of the situations that you're in and protecting those around you. You may not feel sick, or you may not be aware that you are a carrier, but just be aware for other people, wear your masks, and keep space. Social distancing is really important.
As your trusted community partner and chairman of the San Diego Hip Hop Health and Wellness 5K and Festival, I'd like to say thank you to every health expert that has joined us with their testimonial. For those that have logged in on the webinar, there's a survey in the chat that I would ask you guys to please complete. Please share this on social media. We will also upload this onto YouTube and make this available for our youth that may be still studying school, for those that might be watching playoff baseball, for those that are doing other activities. We need to get this message out to our folks, okay? Because tomorrow's funeral for Aunt Louise, who was 101, is going to be tough for all of the Overstreet family members, knowing that she saw the last days of her life with this COVID-19 virus. So it's real. It's not fake. It's not propaganda. Wear your mask, social distance, eat clean food, and we'll be back with all of these professionals. I want to end with just a quick and very, from the bottom of my heart, heartfelt thank you to Dr. Wooten, Dr. Hood, Queen Kaje, Dr. Weber, Dr. Moyo. You guys have been nothing but a blessing to our community. and to this Zoom panel event. Health is wealth. Teamwork makes the dream work. It takes a village. Listen to your mom, listen to your dad, listen to your granny. God bless. My name is Carleton Overstreet, signing off here.